Welcome to the presentation for Nursing 150. For the current semester, this module is Module 9. And this is disorders regarding the respiratory system. For this particular presentation, we're going to talk about infectious disorders of the upper respiratory system. Priority concepts with the upper infectious diseases of the upper respiratory infection are the concept of oxygenation, gas exchange, concept of infection, and inflammation. These disorders include rhinitis, sinusitis, rhinosinusitis, pharyngitis. We will also discuss influenza. It's important to understand that these infectious processes can either be viral or bacterial. It's important to be able to understand how to determine whether the infectious process is viral or bacterial. The reason for that is viruses cannot be treated with antibiotics, although it is a common community misconception that all of these disorders require antibiotics. That is not true. Actually, the higher percentage of all of these disorders are a virus which cannot be treated with antibiotics. We do know for sure that influenza is a virus that cannot be treated with antibiotics. We do have some antiviral medications that can assist with helping the patient recover from that virus quicker. We also have vaccinations that can prevent the occurrence of some of these infectious processes. Community education is very important in the prevention of these processes. It's a really key nursing concept in all of these disorders. Prevention of the spread, a lot of these are very contagious. Viruses and bacterial infections are very contagious. And so our job as nurses, it's really important for us to be able to educate the community on how to prevent the spread of these infectious processes. This slide is basically for a review of the anatomy and physiology of the respiratory system. This presentation is going to discuss the infectious processes of the upper respiratory organ. So basically we're going to talk about everything from here above. So we're going to talk about disorders of the mostly the larynx and the pharynx, and also the nose and the sinus area here. So basically we'll talk about rhinitis, sinusitis, pharyngitis, those kinds of infectious processes of the upper respiratory site. This slide looks a little bit more closely at the upper respiratory area, and we're looking very specifically here at the nasal cavity and the sinus cavities. I'm talking about the turbinates of the nasal cavity, and just the important thing to remember about all of this, these organs are very important parts of the respiratory system that sometimes get overlooked. But their role is to humidify and warm the air that we breathe in. It also filters the air that we breathe in. So they're kind of like a first line of defense as far as the respiratory system. And the nasal cavity and the sinus cavity are the ones that kind of get the most abuse because that's doing a lot of work as far as what we are breathing in from the environment, as far as carcinogens, as far as germs, as bacteria, things like that. And they really act as a protective mechanism for us. And so often they get inflamed in response to the air that we're breathing in. A lot of times this is associated with things in the environment that we have an allergic response to, especially during the change of the seasons. Make sure that you review the assessment of the nasal cavity and the sinuses. The nasal cavity requires that you take a look into the nasal each nair and look at the turbinates. The turbinates are the part of the nasal cavity that helps to warm and moisten the air that we breathe in. And they're bony ridges lined with mucous membranes, and those get a lot of abuse from the things that we breathe in from the environment. The other thing is the sinuses, to kind of be able to palpate the patient's sinuses to determine if they have tenderness, swelling in those areas that can be indicative of a sinusitis. Rhinitis, in its simplest definition, is an inflammation of the nasal mucosa. I feel like everybody in the Cincinnati area has probably had some sort of rhinitis, essentially because we have a lot of changes of the season. We have a lot of environmental pollen and things like that that causes rhinitis in a lot of people in this area. It is a common problem of the nose, and it often involves the sinuses as well. It can be caused by a viral or a bacterial germ, or a lot of times it's an allergic rhinitis, which is very common in our area that we live in. And it's just an inflammatory response to a lot of the pollen that we breathe in from our environment. It's also known, allergic rhinitis is also known as hay fever. You might have heard it referred to as that. But it's basically a hypersensitivity to the airborne allergens that are floating around in our environment. It's seasonal a lot of times in some patients, usually at the change of the seasons, usually going into fall or coming into spring. Is a common time for people to have an allergic rhinitis. Basically, it just gives you that runny nose, that irritated runny nose. Allergic rhinitis is often very benign and self-limited. However, if it's poorly controlled, it can cause loss of sleep. It can cause just an obnoxious kind of feeling bad. It can cause loss of work, fatigue, decreased overall cognitive functioning just because you just don't feel very good. You've got this runny nose and this tender, swollen nasal terminates and tender, swollen sinus cavities related to whatever's causing either a viral or bacterial or allergic origin of your rhinitis. The goal of therapy for a rhinitis is to minimize or prevent the signs and symptoms and essentially just make a patient comfortable enough to maintain their normal lifestyle. If it's an allergy, if it's an allergic rhinitis, which is very common, then avoidance of the allergen, if possible, is advised. However, sometimes that is very difficult to do, because patients need to go outside and they need to be sometimes it can be like a dog or a cat or things like that, and possibly that can be avoided. But essentially, it can be difficult to avoid allergens, but that's typically the treatment of choice for an allergic rhinitis, but not always attainable. Antihistamines are common drugs utilized in the treatment of an allergic rhinitis and some viral rhinitis. These are drugs like first-line antihistamines known as Benadryl or diphenhydramine. We know that can cause some drowsiness in a patient, so that is usually not, patients aren't able to take that and maintain a normal lifestyle. So they've come up with some second generation antihistamines known as loratadine or Claritin, cetirizine, also known as Zyrtec, are over-the-counter antihistamines that are very effective in the treatment of an allergic rhinitis. Basically, these inhibit the effect of histamine at the H1 receptors. Usually pretty safe to take. Like I said, the cetirizine and the loratadine do not cause sedation, so they're pretty safe to take for a patient to remain functional during the day. Decongestants can also be effective in stimulating the alpha adrenergic receptors to cause a vasoconstriction, which shrinks the swollen mucosa. The thing about the over-the-counter decongestants, a patient needs to be aware that phenylephrine is a decongestant or a pseudoephedrine. Both of those can cause an elevated blood pressure due to the vasoconstriction. So that needs to be used with caution. The real common medication that has kind of gotten more popular in the past couple of years is nasal steroids. They are inhaled steroids in the nasal mucosa, and it decreases inflammation within the turbinates and the nasal mucosa. Pretty safe medications. They do cause like a poor taste in the mouth, can cause some irritation in the nasal mucosa if the patient is not careful. but essentially are pretty safe meds if used often. Some common ones is triamcinolone, also known as Nasacort. Those are over the counter now. And I think those just became available over the counter within the past year. Fluticasone, also known as Flonase, is another inhaled nasal steroid that has been shown to be pretty effective in rhinitis. All right, sinusitis, also known as rhinosinusitis, is an inflammation of the mucous membranes of the sinuses. It's usually associated with rhinitis, as I said before when discussing rhinitis, and sometimes people will call it rhinosinusitis. Typically, a sinusitis is caused by a virus. Like 90% of sinusitis are caused by a virus. However, it can be caused by some bacteria. And some people have acute sinusitis, or some people have a chronic sinusitis. Some patients originate with a rhinosinusitis that's caused by a deviated septum. That means that the septum within their nose is actually deviated to one side, and it can obstruct the flow of air. And that obstruction can cause bacteria to grow, and that can become a bacterial sinusitis. Most sinusitis, like I said, are caused by a virus, and those are usually associated with just basically the common cold. And usually the way that we tell the difference is that a viral sinusitis usually is shorter in duration. A bacterial sinusitis is usually longer in duration, and you can usually see a more purulent drainage as in contrast with a viral sinusitis is more of a clear drainage from the patient's like nasal congestion. Fever is more likely in a bacterial sinusitis. I have a slide coming up that kind of compares and contrasts viral versus bacterial sinusitis. One thing that always is very helpful in differentiating between an allergic rhinitis and acute sinusitis is the fact that if it's an allergy, the patient has more clear drainage. In a sinusitis, they will have inflamed and purulent drainage and have more tender sinus areas and be more inflamed and appear to have more nasal obstruction and purulent drainage with a sinusitis, especially with a bacterial sinusitis. Common signs and symptoms of a sinusitis, whether it be viral or bacterial, is usually that pain over the cheek. Sometimes it radiates to their teeth, and they're above their eyebrows. You have sinus cavities and around your cheeks. A lot of headaches, general facial pain, especially when bending forward. It's because of that, all that pressure in those sinus cavities when they bend forward makes it worse. And the purulent nasal drainage, postnasal drip, fever, swelling, just general fatigue and ear pressure is very indicative of a sinusitis. Typically, Tylenol, NSAIDs like Advil, decongestants are usually very effective treatments, especially if it's a viral sinusitis. If it is bacterial, if it's determined to be in a bacterial sinusitis, and amoxicillin is typically the first line of treatment. And then sometimes those sinusitis, you can do like a wet pack or like hot, moist packs over the area just for a comfort. Nasal steroids can also decrease that inflammation in the nasal passages and the sinus passages as well. Sleeping with the head elevated can help the drainage from the sinuses. Avoiding cigarette smoke just because it's an irritant to that already irritated area. So lots of different interventions that we can do for a patient with a sinusitis. Pharyngitis is essentially a sore throat, and I think we can all relate. We've all had a sore throat at one time or another, and it's usually an inflammation of that pharyngeal mucous membrane back there. It can often occur with rhinitis and sinusitis, and a lot of times when it's associated with a rhinitis and sinusitis, it's due to a postnasal drip. So if you've got an inflamed nasal passageway, an inflamed sinus sinuses, you can have some dripping, especially at night. If they lay flat, it can drip in the back of their throat. So a lot of times they'll wake up in the morning coughing and with a sore throat. That's a postnasal drip associated with rhinitis and sinusitis. It can also be caused, a pharyngitis can either be bacterial or viral, or just from irritants like tobacco or alcohol use. It's just important that we determine which one it is, and because we need to treat it appropriately, especially if it is a bacterial infection, also known as strep. Strep can be, if not treated appropriately, can cause multiple other issues within the patient. So a lot of times if somebody has a sore throat, a lot of times they'll just swab their throat to test for strep in order to rule that out. 90% of the time it's viral in nature, especially in adults. Adults do not get strep like kids do. So usually it's viral. However, like I said, it's important to rule it out. The picture with this slide is very, very clear in like showing what we're looking for when we look for inflamed tonsils and a pharyngitis. These are, when that provider looks in the back of your throat, that's what they're looking for, to see what your tonsils look like. They're looking for edema, redness, and something called exudate, which is almost like a drainage from your tonsils, or a white patches from your tonsils, because those indicate that it could be bacterial in nature. They also are going to ask you when you come in with a sore throat, how did it start? If it started with a rhinitis, a sinusitis for 2 or 3 days, and then you got a sore throat, they're going to determine it's probably viral in nature because you started out with a viral common cold. Strep, they're more suspicious of strep if a patient shows up with just sore throat. Started out with a sore throat, a fever, headache. I don't have any rhinitis. I don't have any sinusitis. They're going to suspect more of a bacterial pharyngitis because that's usually what strep looks like. But again, they might just swab it just to be in case. Just to be clear, because we've got to treat strep. Strep can actually, if not treated appropriately, can cause stay in the body and can cause damage to your heart valves or your kidneys. This damage is known as a rheumatic fever in the heart, and in the kidneys it's known as acute glomerulonephritis. It can cause an infection in your kidneys, and we talked about that infection in your kidneys, how it could actually damage your kidneys. And then the rheumatic fever could actually damage your heart valve. We don't see this as much anymore because we do have that rapid strep test that we can do very quickly now on patients. More patients are more inclined to take themselves or their children to the doctor now because they know that strep needs to be identified. And a lot of times you'll hear people say, I just went to the doctor to make sure I don't have strep. And that's because we know that if strep is not treated appropriately, it can cause damage to other body systems. I kind of answered these questions in the last slide. There is a great chart in your book, in your IGGY book, that compares and contrasts acute versus bacterial pharyngitis. And like I said, the bacterial pharyngitis, also known as strep, is usually a more sick patient that essentially usually presents with a sore throat and nothing else other than a headache and feeling very bad and having very, very much difficulty with swallowing. Viral pharyngitis will present with other symptoms such as rhinitis, headache, sinusitis, signs and symptoms, and a gradual onset. Bacterial pharyngitis will present more with an abrupt onset. Sometimes bacterial pharyngitis will also present with a rash, so that's can kind of help differentiate the two. Bacterial pharyngitis must be treated with an antibiotic, and sometimes they'll do a rapid strep test, which means they'll swab the back of the throat and identify whether it's a strep or not. If it's identified as a viral infection, no antibiotics are required. The patient must rest, increase fluid intake, humidify the air, and use some Tylenol or some Advil for pain. Gargling with warm saline can help to soothe the back of the throat, and throat lozenges as well. But the big thing is rest and fluid intake. And one thing to be sure of to tell your patients with the bacterial pharyngitis that get treated with an antibiotic, they need to take their antibiotic as directed. They need to take it, all of it, even if they begin to feel better. That's always important to teach your patient who are put on antibiotics for any kind of a bacterial infection. Okay, we're going to move on to a topic that none of us like to talk about, I think, the seasonal influenza, also known as the flu. We know this is an acute viral respiratory infection. It's viral. That's the difficulty about it. It is highly contagious. Those that are at risk for having complications associated with the flu are the very old and the very young. We know none of us want to get the flu. It can have a rapid onset of severe headache, muscle aches, fever, chills, fatigue, and weakness. And essentially just make us feel awful all over. And really the key to the flu is prevention, preventing us from getting it. That's why we often promote vaccinations to prevent it. And basically it's not only to prevent us from getting it, but we want to prevent people from getting it so that it doesn't get spread, because again, it is a highly contagious acute viral infection. Again, vaccine is one of the preventative measures, and it is advisable. It's a yearly vaccine that people are encouraged to get. And the specific viral strain is difficult to mimic, so it can be a challenge. Usually the vaccines contain 3 or 4 antigens for 3 or 4 most expected viral strains. So they do the best they can in getting us this flu vaccine. You can get the attenuated influenza vaccine, which is a shot, or the intranasal spray, which is also known as flu mist. The intranasal vaccine is live, and some people develop influenza symptoms after its use. It is recommended only for healthy people up to 49 years of age. Yearly vaccine is recommended for those older than 50 years old, or for people with chronic illness or immune compromise, or for those living in institutions, and for those of us who work in healthcare. It's highly recommended. And we know during the flu season, the most important thing is to teach patients how to reduce the risk of spreading the flu. Stay away, if you're feeling bad, you need to stay away from people who are at risk for getting it and who are at risk for having major complications associated with getting the flu. Teach the patient who is sick to reduce the risk of spreading the flu by thoroughly washing their hands, especially after blowing their nose, rubbing their eyes, or touching their face. Stay home. That's hard for us to do sometimes, but really that's what we need to do to prevent the spread of the flu. Make sure that they wash their hands. That's a big thing, and to stay away from hospitals. So nursing care of the patient with influenza is making sure that we identify if they have the flu. Once we identify that they have it, they need to stay home. They need to increase fluids. They need to treat their fever and aches with Advil or acetaminophen. Fluid intake is one of the best ways, and if they can't get foods down, they need to do fluids such as Gatorade or something like a Pedialyte in order to maintain their hydration, especially in the very old or the very young. Also, patients who have comorbidities, other chronic illnesses such as maybe a lung disease already, they're at risk for becoming extremely sick from this, and they could end up hospitalized. Patients with COPD, which we'll talk about in Module 8, or asthma are at extreme risk for having complications associated with getting the flu. So those patients are highly encouraged to get the flu vaccine and stay away from people who are ill so that they don't get it, because they're more likely to have complications associated with it. Okay, a couple of times we've had pandemic influenza. And remember, I think most of us remember the H1N1 scare, which was the swine flu. Basically, these are viruses that are typically manifested in animals and birds, but not transmitted to humans. but sometimes the virus is able to mutate and become highly infectious to humans. The thing about these is they can make humans extremely ill because our immune system has difficulty in fighting off these viruses because they are typically found in animals. So our body is not equipped to fight them off. And so that's why it's extremely fearful for a human to get these vaccines. H1N1 was the most recent one, I believe. The bird flu is another one that we have kind of encountered in the past 5 to 10 years. So strict isolation precautions. A lot of, again, what you'll hear about flu is the prevention from the spread of it, and isolating patients so that it doesn't get spread. And it's a big part of the nurse's role in making sure we educate patients about how to identify it and prevent it from spreading. One thing just to mention as well is antiviral meds. We do have some pretty effective antiviral meds for the flu, and it's known as Tamiflu or Rhinitis. These are pretty expensive antiviral meds. And the real important thing about these medications is they can, basically what they do is they decrease the complications that a patient might have with the flu, and they'll shorten the duration of the time that they are ill with it. The important thing is, though, we have to identify that they have the flu and treat them within 48 hours. So if they've had these symptoms for 3 or 4 days, Tamiflu or Rhinitis is not effective for them. So we have to identify that they have the symptoms. And we do have ways that we can swab patients now for flu. We can do a quick swab for flu to identify if they have it, because we want to treat them early. These medications, like I said, are only effective if used within the first 48 hours of the onset of symptoms. Just a real quick question for you to review and assess your learning regarding infection of the upper respiratory infection for Module 8. I encourage you to try to answer the question and check yourself within the comment section of the PowerPoint that is posted in additional resources. This concludes the presentation, Part 2, for Module 8.